When you're facing shoulder surgery, everything suddenly feels urgent. You want to get it right. You want to avoid mistakes and set yourself up to heal fast. But that's also when some of the worst scams hit you, before and after surgery. Today, I'm going to walk you through the 4 biggest shoulder surgery scams, hard to say, I see patients fall for all the time, whether they're preparing for surgery or recovering afterwards, and how to avoid them without risking your outcome. Hey there, I'm Dr. Daniel Orcutt. I've helped over 1,000 patients recover from shoulder injury and shoulder surgery, and I get frustrated at how little real guidance most people actually get. If you're dealing with pain, prepping for surgery, or wondering what you're going through is normal, you're in the right place. I'll cut through the noise, give you the truth, and help you heal smarter. And by the way, if you haven't grabbed it yet, please check the link below for my pre-op shoulder checklist. It's a simple step-by-step guide to help you feel more prepared for surgery. So scam number 1. First up, this is ice, right? This is peas that you can use as ice. These work well. There's other things that work a little bit better. I do like the cryotherapy cuffs. However, there are a lot of overpriced gadgets. $2,000 cryotherapy machine, shoulder braces with air pumps, high-tech sleeves that claim to speed up healing. You'll see a lot of this stuff pushed before and after surgery. Ads saying prepare your shoulder for the surgery the smart way, or this device will cut your recovery in time in half. Now, to be clear, again, I do like some cryotherapy units, but there are good units out there for 100 or 300 range that can really help. They can help with post-op pain and swelling, especially in those first few weeks. What I don't love are the luxury-priced hospital-grade machines being marketed like they're miracle tools. In most cases, a simple mid-range ice incompression system will do the job very well. You don't need to mortgage your house for a cold therapy unit. In fact, some of these high-end models are better at draining your wallet than they are at recovering you from surgery. What matters more than the gadgets is how and when you use it. Regular icing, keeping swelling under control, and not leaving it on too long, that's how you use it right. That matters, but the fancy gear, that's mostly marketing. So think about that before you spend the big bucks. Quick question, have you already picked a cold therapy unit or an ice pack for your surgery? Let me know. Down below in the comments what you're planning to use. It might actually help someone else feel more prepared. So that's 1 down. Let's move on to scam number 2. And you won't believe number 4, actually. Keep watching. Okay, scam number 2, miracle supplements. Miracle pills you've probably seen in ads, collagen cures, anti-inflammatory, super blends, tendon repair in a bottle. And these hit hard before surgery too. You'll hear things like, prep your body for better healing, or don't go into surgery without this anti-inflammatory booster. Look, your body does need good nutrition. That's true, especially some protein, vitamin D, and some things like vitamin C and zinc. But those don't come in flashy bottles with gold foil letterings and an $80 price tag. A healthy, balanced diet will get you most of the way there. If you're low on something specific, sure, supplements can help, but there's no pill that can replace proper healing time, physical therapy, sleep, and smart movement. So plenty of ingredients out there may give some general benefit, but when they're marketed as like a magic bullet, that's your red flag. And let me say this clearly. If it sounds too good to be true, like in all life, it probably is. Now, I do have my own preferred formulas that I recommend to some of my patients. The ones that have third-party testing, clear labeling, and no outrageous claims. But even then, they're not miracle workers. They're just one small tool. They're not the whole toolbox. All right, scam number 3, PRP and stem cells. Scam number 3 is one I see more and more. PRP and stem cell injections. These are marketed as biologic breakthroughs that will supercharge healing and reduce inflammation and maybe even regrow tissue. Sounds amazing, right? Before surgery, they're often pitched as a way to avoid surgery altogether. And after surgery, they're marketed as the missing step that will boost your recovery. I've seen patients spend $3,000 or more on these injections before surgery, hoping they could avoid going under the knife altogether. But here's the truth. If you have a full thickness rotator cuff tear where the tendon had pulled off the bone, no injection of anything is going to reattach that tissue. It needs to be repaired. Let me tell you about a guy that I know and I saw not too long ago. He came to me asking if I could take a look at his shoulder after stem cell injections. He paid thousands for them, but here's the thing. They'd never even done an MRI. They didn't know what actually was wrong. And so he was hoping injections would just fix it. Like that's like putting new tires on a car without checking to see if the axle's broken. The problem? There's very little evidence that these treatments do anything meaningful in that situation, and they're almost never covered by insurance. These injections might help with certain types of tears, certain types of chronic shoulder pain, early arthritis, but right after surgery or when the tendon is torn off the bone, there's no solid data saying that's going to work. And be careful with the term stem cell. A lot of what's being sold isn't even regulated. If your surgeon just fixed your rotator cuff, you probably don't need an injection of pixie dust into it 3 weeks later. If PRP ever becomes a game changer, you'll hear about it in the orthopedic journals or from me, not Instagram ads. So that's 3 down. Let's talk about scam number 4. Scam number 4, PT shortcuts and online recovery programs. The last scam is subtle and often well-intentioned. Online recovery programs and PT shortcuts. Here's how it usually goes. You're frustrated, progress feels slow, then you see an ad promising fix your shoulder in 2 weeks with a series of exercises or a custom app. Sometimes these pop-ups even before surgery, trying to sell you on an idea that you can prehab your way into a faster outcome with a 3-day miracle cleanse or routine. And actually, you'll even hear from a physical therapist who claims you can heal your rotator cuff tear without surgery, no matter how bad it is. Now, this might be true in very small partial tears or tendonitis. But again, if your tendon has completely pulled away from the bone, no amount of stretching or bands or mobility drills are going to reattach it. Here's the truth. Recovering from shoulder surgery is a phase-guided process. If you skip steps or try to rush it, you'll risk re-injury or frozen shoulder or long-term pain. You need a licensed PT who understands your specific surgery, your body, and your timeline, not a generic plan made for internet strangers. I've seen patients follow a YouTube video and end up in worse shape than they were before. Not necessarily because the exercises were bad, but the timing was wrong, right? They didn't understand the process, the steps. Real progress comes from consistency, gradual loading, and personal adjustments, not just from shortcuts. So, if this kind of street talk is helpful, hit the like and subscribe button. It helps more people find their way through recovery without all that confusion. So let's wrap this up. Recap: overpriced gadgets, miracle pills, biologic injections, and shoulder recovery shortcuts. These are the 4 biggest scams I see people fall for before and after surgery, and they usually hit when you're most vulnerable. But here's the good news. You can absolutely recover well without wasting money, risking your outcome, or falling for hype. You don't need magic. You need clear guidance. You need good nutrition. You need smart PT and a little patience, or actually a lot of patience. And if you want to stay on track, again, grab my shoulder recovery checklist. It's in the link below. It's what I wish every patient had before surgery. And if you want to keep learning, watch this next video. Disclaimer: this information is for educational purposes only. It is not medical advice. I'm a physician, but I'm not your physician. This content does not create a doctor-patient relationship. Nothing here should be taken as a diagnosis or personalized treatment plan. Talk to your own healthcare provider before making any decision about your health.